back, everyone, to Teens No Cap. I'm your host, Charity Chafee. I'm a licensed mental health counselor specializing in the treatment of high-risk teens and adolescents and their families. And we have back with us today, which I'm so excited, Dr. Emily Gordon.
Thank you, Charity. I am so glad to be here. I loved our first conversation. I love all the things you're doing for teens and families, and I'm really looking forward to this conversation.
Yes, me too. And I hope you've been doing well, but I don't know if you want to give us a little story about your face.
Thank you. Yes, I think that's important to say. I am okay. I may not look okay. Had something removed and it's affecting my whole face. And it's a good reminder to me. Some of my family and patients have reminded me that it's not about what we look like on the outside. It's about what we are in the inside. So I guess I'm here, I'm showing up, and hopefully it won't be too upsetting for other people to see.
No, you're in good company. We all have those times, and you are here and glowy and beautiful as always. So,
Well,
and your brain, because really a lot of this is about your brain today. So we both work with teens. We both work with some eating concerns, disordered eating, etc. And I had asked you on today because I have seen, and I know we are all experiencing this kind of like intensity and an increase in seeing like GLP-1s as part of our
yes.
like normal society.
Yep.
And being as I feel like we have a lot of connections in terms of our population, I knew that we'd have a really awesome discussion about like GLP-1s, the history, the place they are, all those things. So I
Yep.
would love to dig into that with you today. And this is going to be a two-part series for everyone who's listening, because there is so much to talk about in regards to GLP-1s.
Yeah, well, it feels like it's kind of all anybody is talking about, adults and also teens. So I really appreciate the invitation, and I think that any kind of thoughtful, kind of like examined conversation about this topic is really important because I think part of what's happened is that it's just sort of like exploded. And one of my biggest concerns is that there hasn't been a lot of kind of deliberation and data and sort of thoughtfulness around when and why and how we use those medications. And I think that's always important, but I especially think it's important when we are talking about teens and like adolescent development.
Yes, of course. And I totally align with that because I do think that because there's been so much information out there and there's all these advertisements, there's a lot of like social media buzz around it. We're kind of seeing it everywhere. And I understand that we're having conversations about like some of the surface level stuff, but I don't feel like there are a lot of people who are really jumping in into considering like these deeper issues that are connected to all of this and potentially lifelong impacts, side effects, pros and cons, etc. So I'm very excited to have this conversation with you today and like jump in.
And I guess as before we jump in, I want to just preface this by saying, like, I am not a medical doctor, right? I am not here to speak about the sort of, we will talk about some of the medical pieces, but I am not a physician. I'm not a medical provider. And if we have questions or people need data and research, then that is something they should find. Part of, I think, what we are going to be talking about and concerned about is the implications for emotional development, for self-esteem, for body image, for eating disorders, for those topics.
Yes, yes, for sure. And I love that you said that because again, like we're not medical doctors. We're really here focusing on the emotional like health and wellness of like our teens and also wanting to support conversations with families. If you have someone who's considering this, if you're having conversations with your teenagers about GLP-1s, because I know that there's always two sides to every story. And I think that GLP-1 sometimes makes things feel really easy, but there's a lot of layers to it. So okay, so Dr. Gordon, can you give us kind of a background history of GLP-1s, where they came from, why they're here?
Okay, so GLP-1s are medications that started for the treatment of diabetes. They regulate insulin by suppressing appetite and slowing the sort of gastric process. So that is how they sort of regulate insulin. And there for some people, again, this is the medical piece, but they're very important, very useful medications for a particular set of medical circumstances. But I think what's happened is that it's somewhere along the lines, it switched and it became clear that it would be useful for weight loss. And the culture that we live in is it's about consumerism, it's about capitalism, it's about industry. And I think that the weight loss and the pharma industry kind of realized that they could potentially make a lot of money by marketing this medication. So, I think there is a medical use for it, and also they are being used a lot for weight loss. So there's that. I feel like I have a lot of caveats. The other thing I think is important for us to maybe say is that I recognize maybe some of my perspectives or some of the things we might talk about may be different than how other people feel or might seem a little controversial or, because I think that our culture has really bought into this idea that like weight equals health. And so when I say that the GLP-1s are being used for medical reasons and also for weight loss, some people might say, well, isn't weight loss health? And I think that's where, again, we have to just stop and pause because sometimes it is, and maybe on a larger sort of epidemiological level, but really weight loss does not equal health. And so that's the other really challenging thing here is that we have to look at individual factors and sort of what goes into an individual's health when we are considering medications. And I think a lot of decisions get made that are sort of more based on these like population level.
I think this is part of why this conversation can be so tricky is that there obviously are a lot of components to it and there's a lot of things to consider. And I think that's why, like, when I am talking to someone about a GLP-1 or even with like friends or family, it feels very straight up black and white about it being a yes or a no versus I think when I think about this and I think about the health and wellness and like what we are cutting out, right, in order to like support a GLP-1 scenario, we're essentially like skipping over a lot of things that we would say are grounded in the philosophy of mental wellness.
Right. I think that's so true. But even before I address that, like what you just said, what stands out to me, what I think is important to say is that, when you are having that conversation with someone, when I am having that conversation with someone, there is this jump. And I think that that is also part of what's happening in the culture. And that is part of, I think, what some medical providers are jumping over and skipping. And even, you mentioned very casually at the beginning, like, the emails, right? I mean, I don't know about you, but in my email junk box, like I started to notice like every day I am getting tens of emails about, so I don't even know like where people are getting these medicines, like whether they're coming from medical providers. And so I think that there's a lot of ways in which this conversation is getting skipped over, and we don't have the data yet for the long-term implications or safety or impacts on development. And so, we're kind of left to struggle and to ask these questions without real information, which also makes it really challenging because most of us are really trying our best. Most of us are trying to make informed decisions. But I think sometimes that information is at best not known and maybe not acknowledged and maybe twisted.
Yeah. Well, and it brings up this kind of like going back to what you had originally said about GLP-1s essentially being, created and prescribed for diabetes, right? And now we have taken that and we have just translated that to like national, international people who like may or may not have like the medical piece. And it's just so interesting how like people who struggle with a very real condition of like diabetes who like weight loss for them could be a very healthy part of their journey, right? We have taken that and said, oh, it's okay. Just take the GLP-1s. Everyone is doing it, right? And it does feel like almost every time I open up social media, every time I open up something, that there is some sort of inundation of, I'm on GLP-1s. I lost weight because of GLP-1s. Like, I know there was a big controversy over Serena Williams, right? Taking GLP-1s and like marketing that to people, considering her body type and all this different stuff. So it's such an interesting conversation, but I do think that in order to really, thoroughly prescribe medications, we have to understand all of the different components and the long-term trajectory, even if we don't have the data for it.
Yeah. Absolutely. So again, I feel like it's it's so hard to organize because there's so many things you said, but so a couple things in there. One is that I think that that comes from the culture that we live in that sort of subscribes to these ideas that thinness is always desirable, that weight loss is always healthy, that fat bodies are bad, right? That like everybody should be and can be losing weight and that that is always healthy. And what we know is that I understand that is the belief that is out there, but that is actually not so. So that's like the first thing that so that's like where this is coming from, right? I also very much understand that look, I mean, we all want to feel good and we want to take care of ourselves and we want to be healthy, whatever that means to us. And we want to feel like we are good enough and that we fit in and that we are acceptable. And I think our culture, unfortunately, and our medical system to some degree sort of teaches that weight loss is a fix to that. So again, it gets very tricky to try to tease out like what is sort of medically indicated weight loss and what is sort of this more emotionally like defined weight loss. But there is this idea that this is a good thing. And when we dig into what they do, if we go back to the science behind them, right, they decrease appetite and slow the the sort of GI system. And I'm sure you've heard people talk about not being interested in food, right? Forgetting to eat. What we're actually like when you kind of slow down again and understand what's happening is that it's disconnecting the communication, the sort of internal communication about like self-nourishment. And the decrease in appetite and hunger actually is leading to malnutrition. And so a lot of so again, like there can be benefits, but as everything, I mean, I think people in my life get tired of hearing me talk about pros and cons, right? There's pros and cons to everything. Like nothing is all right or all wrong. Nothing, the idea of perfect doesn't exist, right? There's always pros and cons, and whatever decision we're making, we are always weighing those, like what are the costs, what are the consequences. So there are some real risks of decreased nutrition. We want to call that malnutrition. We want to call that starvation. Like these are all words that I've heard used to describe the states that are induced.
Yeah. No, and I think that is like such a good point, and I think that that is part of why it's unfortunate. I think that so many people are jumping so quickly to GLPs because I feel like if we're not talking about the very real risk of like starvation, malnutrition, dehydration, right? Like when we're talking about any sort of kind of like weight loss component, whether it's the gastric bypass or like stomach surgeries or like any of those pieces, there are actual considerations for your diet and nutrition that you have to focus on, right? So I think there is a process of like taking GLPs, and I think there's a process of like medically being supervised taking GLPs that have a very practical, real outcome for you. And a lot of the things that I have heard from either the teens that I work with who are on GLPs or parents that are on GLPs or friends is that like, oh, at some point I don't have to take this anymore. And the other part that's really hard and interesting is that I've also heard the component of like, well, once you're on it, you kind of are on it forever. So then if we're thinking about that in terms of malnutrition and like actually feeding your body, you're potentially committing to like a lifelong understanding or like disconnection or like malnutrition unless you're really cognizant and aware. And to be honest with you, there are a lot of people who don't understand what's even in their food to begin with. And it's so interesting to me because then as you were talking earlier, I was like, how wild is it that we're basically giving people GLP-1s when our food system is a mess and our processed, foods have more stuff in them that we can't even pronounce than ever, right? The ingredient list for a lot of our stuff has amplified by like 400 million, right? And then we're telling people, oh, your solution to feeling healthy and feeling good in your skin is to take this GLP-1, and it's actually not to fix the food system, and it's not to fix our understanding of nutrition, and it's not to fix your own connection with food and your mind body wellness. Just take this and everything is fine.
Yes. Yes to all of that. A few weeks back, and I may be dating us, but there was it also gets into like our political systems, right? And sort of equity. And because if you remember, I think it was maybe a month ago, there was the week that the government like increased access to GLP-1s and sort of made them more affordable. At the same time, that was the week that they like were having the governmental like shutdown and the SNAP benefits were all cut. And it was sort of infuriating, right, that we are not taking a systemic approach to this. And I think you made such a good point about nutrition and health. And I think, again, that is not on us as individuals, that is on the medical system, that is on the government, like that is on our institutions. That I think that, again, whether some of the prescribers like don't know the risks because either they haven't done the research or we don't have the data, right? Because again, these are like this more widespread use of these medications is new. We have the data on sort of what it has been like for people who have been using them for diabetes, but this widespread use and the use in teenagers and like we don't have the data on that. And so I think to your point about really making informed decisions, in medicine, we talk about informed consent and we talk about ethics and how do we really make like these are difficult decisions. There's no right answer. And I'm not really sure who should be telling or deciding. I'm certainly not here telling people what they should or shouldn't do. I just think that it's important that we really slow down and we think about it and we ask for data and information. And again, coming from the lens of working with teens and working with people with eating disorders and trying to prevent future development of eating disorders. I think we really, really, really need to be thoughtful and careful about how we talk about this and how we use them and what the impact is.
I'm so glad you brought that up because I think working with teens, obviously, I can understand that a lot of the initial experiences that they're going to have in their life is going to be scaffolding for any sort of future conversation, future relationship, future whatever, right? So I take my job very seriously as a teen therapist because I know that like if it's their first time or even their second time in therapy, that is going to be a grounding and a stability and a scaffolding feature that they're going to use for the rest of their life in terms of their connection with therapy. And I think about the GLP-1s in teens, and I'm just like, how is that any different? Because we are setting up scaffolding for this teen, right? Regardless of how age they are, how old they are, that is going to be something that's going to be part of their self-concept for years to come, right? And one of my big concerns is that if we are prescribing GLP-1s like it's water, which again, no one is here to tell anyone what decision to make for their own bodies. But if we're prescribing them so easily, and then a teen is like, oh, it was super easy to lose weight on a GLP-1, right? But then in the future, they decide that that wasn't right for them or the symptoms were too bad, or let's say we don't have access to GLP-1s, and then they're trying to lose weight again. Then there is this concept of like, I'm a failure, I'm an embarrassment, I can't do this. And then I think it sets the stage for long-term chronic eating disordered behavior, even if it's not a full-blown eating disorder, because they're trying to match the experience from a miracle drug that they had when they were 15.
I mean, yes. And also, the presence of these drugs, like not even kids, teens, adults taking them, but just the presence of these drugs in such a widespread manner, like creates the message that you can and you should use them. And that, again, losing weight is important, that fat bodies are not okay, that that it's healthy to pursue weight loss, right? It underscores and magnifies this message that we're not okay the way we are, that our bodies are something to fix. So even before we get to what you said about taking them, like I don't have in my practice, I don't have anyone that I know of, um, any teens that are taking them, but I do have some young adults that are in recovery from their eating disorders, or they are in their like process of working on recovery. And what I've been hearing is, oh my goodness, I was at work, in my first year of my first job, and I'm eating lunch with colleagues, and everybody's talking about their GLP-1s. And I'm just working on trying to remember that it's important to eat lunch. And here I have to listen to everybody talk about, losing weight and not eating lunch. So there's so many layers of, even when it's not you yourself or somebody taking the medication, how it impacts our sense of self-acceptance and body size and body image. And then you're right, the experience of taking the medications. And again, we have to look at the side effects because, again, weight loss is a result of this medication, which for some people like feels good. And yet there are also other side effects because the GLP-1s, what we know is that, decreased nutrition impacts like every way of functioning. It affects our emotions because it works on serotonin and dopamine, right? So it can affect our mood, it can affect our pleasure, it can affect our learning, our memory, our thinking, our processing. So thinking about teenagers taking these medications, even if they work in one way, they are potentially creating other side effects.
Well, and I think that obviously there's a lot of gray here in all of these conversations because I think it's hard to, one person's journey through health and wellness may or may not include weight loss. Another person's journey through health and wellness, like, may include that in a GLP, right? There's all these different components. And that's why I think it is really complicated with like the lack of data we have, the lack of like research and insight, the lack of, people fully being trained in like what these are. And like, when I'm working with someone who is like seeking out any sort of like psychiatry medication, like my gut instinct 9 times out of 10 is to send them to who? A psychiatrist. That is their thing. That is what they see. That is what they know. And I think that there are a lot of people, because you had asked like where are we even getting these medications from? And I think that there are a lot of people who see the side effects and they want that, right? Without understanding all of these deeper components. And they seek out medication and then they don't have the support to really understand how to make that decision for themselves and what is part of that. And that, like, at the end of the day, is it always about weight loss?
Right. I think that's very true. Which again is not on us on individuals. I haven't actually clicked through because I can't bring myself to even open those emails. But, I'm so curious, like, who is it that is sending me an email that is telling me like I can just take this medication, and what is it? I don't know. Like, I mean, who's getting these emails? Like, what is it? So yeah, so I think that's a real problem. So I think if we think about like, what do we do about this, right? Or how do we help people to make these decisions? I hope, that this conversation reminds people that like there are questions to ask of your providers. There are pros and cons, there are risks and rewards that are important to consider. There are potential side effects. I have also heard I've heard what you said, I have heard that once you go on these medications, in order to maintain the effect, you do have to continue them. And yet I don't know if that's actually, I don't know what the medical position on that is. And I don't know if people realize that, if everybody realizes that when they consider them. So I think I would really encourage parents, adults, young adults to really ask a lot of questions and try to get some information, as you would with many decisions about health and medication, and really make a decision for yourself around what are your goals and what are you hoping to achieve and what are you willing to tolerate in that pursuit.
I think that's like such a great point, and you had mentioned it earlier of just like slowing down, right? Slowing down and being really thoughtful and really considering it and being curious about what the potential impacts or like positives could be about taking any sort of medication, right? Because even with psychiatry medication, we're always asking like, what is the benefit of this, right? What is the risk? What is the reward? Right. And I think that's part of just being really thorough. And we have a little bit more data on the psych meds that some people are taking. And so I do think that that helps, make it feel a little bit safer. I think with GLPs and really with any medical decision and even mental health decision, right? Slowing down, asking the questions, really understanding like how would this impact not just my friend, right? Because I think the teen brain is often like, well, my friend's taking it and they're fine. But really pushing that curiosity in terms of like, okay, like it's great that your friend that had that experience, but like, do you share the same genetic structure? Do you have the same, immunization stuff? Do you like really kind of questioning this space of like, so if for you it could be a good impact, but what if it's not? And I think that's a piece that we don't spend enough time talking about of like, what are those pieces that like could impact you long term if it doesn't work out the way you think it is?
I love what you just said, and I want to say two things to that. One is that is exactly what you and I work on in therapy with teens and with anybody, right? Which is that tuning into oneself and trying to understand, who am I? What do I need? What is my body telling me? What are my values? Like that sort of internal self attunement. And I'm going to say this because I'm hoping maybe we will have a follow-up conversation and I can encourage people to tune in later, because I think that's exactly what one of the risks of these medications are, is that it sort of interrupts that process, that sort of connection with internal cues. So we can put a pin in that and maybe talk more about that later. But I want to talk about the talking about medication, right? Because one of the things that I often say to people when we're weighing the pros and cons of a psychiatric medication is, okay, what are the pros and cons of taking this medication? And what are the pros and cons of not? So what are the risks? Because obviously, I mean, some of these medications, they do have side effects, they do have risks. But we also have to look at, what is the risk of not treating this issue? What is the risk of not addressing your mood or your anxiety or, whatever it is that you're struggling with? And so, and then like how do I proceed? How do I manage that? And I think that's again a really important question here, is like, what are the pros and cons of taking them, and what are the pros and cons of not taking that? And then like how could I navigate each of those scenarios?
I think it's a great like scaffolding, right, in terms of decision making of like how do we really decide between like options. And I think the other piece that I'll like point out too, and just for our society, is that we're very much a quick fix society now. We are like a consumption capitalistic quick fix society where like we don't want to wait, we don't want to slow down, we want all these things, we want all these things, we want to do this thing now. And like it's just interesting how, like even fast fashion is something, that a while ago I was like, oh, whatever, like that's not a huge deal, right? 5-10 years ago. But now like that concept, that ideology is like seeping into like literally everything we are as humans. And so like I do think that there's a huge societal component to this, right? And I think it's not on us as individuals, but it's on this greater understanding of like, what is the goal for this? But it's interesting how all of these consumption behaviors are really just being put through like every area of our life. And there's kind of, I guess, a competition because the pharmaceutical industry is like, we want everyone on these medications and we want to sell and make money because that's the capitalism part. But then when we're doing that, we're also completely cutting back on our food chain. And if people aren't consuming a lot of stuff in our food chain, then like that is going to impact that industry. It's just so interesting to me.
It's so interesting, right? It's so complicated and layered. And again, I think you're absolutely right about this sort of like quick fix or, sort of easy answers kind of, but that's again why it's so important to just slow down, right? Because I think that if we don't pause, if we don't take a deep breath, we just get caught up in that and we sort of like it can't help it because it's coming from our culture, it's coming from our systems, it's coming from our technology, like it's coming from like people in our like it's coming from everywhere. So again, just more rationale for slowing, thinking, considering, asking for data, asking for information, and thinking about how do we how do we make sense of this for ourselves and how do we help our teens to make sense of this.
Yeah. Well, I was gonna say I think the rough part about I think being a parent to teens right now is that you might have a teenager that comes home and says, "Hey, like my friend is on this medication and she's lost all this weight," or like this is where they're at. Like I want this medication now, right? So now you're in this really sticky spot. Where as a parent, you like want to understand where your kid's at. You want to understand the options that are there, and you don't want to disappoint them. But like that is an entirely like massive conversation with lots of different layers and like there's no one right way to have it, but I do think that like I appreciate like so much of this is like let's pause, right? Let's pause and really just take a minute, a 2 minutes, 3 weeks, whatever we need, and really thoughtfully consider this from a variety of angles, right? What would be helpful about it? What would be hurtful about it? What are the pros and cons of taking it and not taking it? How is this going to impact your life? How are you going to like manage this in 10, 15 years, right? What are all of these long-term side effects? To really allow yourself to think through all of those different pieces and decide on a path that you feel comfortable with, whether it's for you or for you and your teen or just your teen.
Well, I couldn't have said it better myself, right? I mean, that conversation would be a gift. And that conversation, I mean, I talk about this so much and like, I mean, that sounds very similar to conversations I've had like, hey, all my friends have a cell phone, I want one too, right? Hey, all my friends have TikTok, I want it too. And those conversations are hard to have, but they are so important and so valuable because it's not only the conversation, it's about it's about the way you're communicating with your teen, right? The way you are empathizing and validating, the way you are modeling, the way you are teaching, and the skill that you are encouraging. That is all I want to do in my work with teens, with young adults, with anybody, right? Is how do we tune in, right? And like figure out ourselves and who we are and what's important to us and what really matters.
Well, and I think that's, and obviously this can absolutely be like a part two scenario is like when we think about that connection to ourselves, that's also something that we are either knowingly or unknowingly role modeling for our teens, for our clients, for our teen, if they're your children, right? Like we are role modeling all of those pieces. So like just the idea of the presence of a GLP sends a lot of messages that then require a lot of these conversations and like maybe even like a realigning or redistribution of the relationship and the connection. So like and that's why I in the beginning was like it's not so black and white, right? Like we really have to live in the gray with this because it is so much more complicated than just whether or not you should take a GLP. So, but it's a great place to wrap up because I know we'll have part two and we can like dig into all of this.
Well, I look forward to that.
Me too. Thank you so much for being here today. I know we have many, many other things to talk about with this, but
Yep.
everybody stay tuned for part two.
Well, thank you for having the conversation and for sort of like helping me and all of us pause and really think about this and be thoughtful. So thank you.
Yeah, no, of course. This is the whole thing, right? Is like helping people and providers and parents and anyone who this kind of impacts to like understand all these different angles, because the way that I see it, the way that you see it is very different, and I appreciate your perspective
Thank you.
ongoing, of course, because I think that we bring such different attitudes and values to it, but there's actually
Uh-huh.
so many things that are aligned.
I agree.
So, all right.
Well, thank you.
You are so welcome. Thanks so much for coming today. We will see you next time for part 2.